To host our proceedings this morning, please welcome a columnist for the Washington Post and host of Public Radio's popular Week in Review program, Left, Right, and Center. Please welcome Matt Miller.
Good morning, and welcome to the Health Data Initiative Forum 3, the Health Datapalooza. That's the best you can muster for the Health Datapalooza? Come on. There you go. This year's event is hosted by the Health Data Consortium, a collection of public and private organizations that came together at last year's forum to encourage the creation of a health data ecosystem. The consortium promotes and accelerates the innovative use of health data, as you know, and today is going to showcase the amazing uses of data to solve pressing health problems. Now, I have to say, this is my third year, so I feel like the Burt Parks of the Healthcare Data Initiative. To those of you who remember the Miss America pageant in Burt Parks for all those years, and I am delighted and excited and thrilled to see how this entire enterprise and collective and effort has grown. It seemed like 3 years ago, I mean, there was a time when this was just a few folks in a room with an idea and a fax and a telephone, and the trajectory over the last 3 years has been impressive, important, and I think very consequential. I mean, remember, from an idea just a few years ago, that by liberating all this data and by empowering the entire sector, there'd be a way to actually improve the quality of healthcare, the cost effectiveness, the patient experience, and more. And now, several years later, as you'll see as we go through today and then, of course, tomorrow, you've got companies forming around this data. You've got nonprofits and for-profits working together. You've got existing companies incubating and acquiring new firms to do this. All of this in the spirit of accelerating the impact that the intelligent use of data can have on our healthcare sector. One thing just to bear in mind as we go through this morning is just remember that the stakes of these efforts, beyond just the exciting whiz-bang potential of the different applications and efforts and growing firms that you're going to see, the stakes for the country are enormous. Remember, the big picture is the U.S. is spending 17% of GDP on healthcare, headed toward 20%. We're a total outlier among advanced nations. Every other OECD country spends 10 or 11% with similar health outcomes. Mighty Singapore, a fetish of mine, spends 4% of GDP with similar health outcomes to our own. So, and you have these huge regional variations, as most of you know, in the intensity of services and procedures used across our system. All of this spells radical inefficiency in our healthcare sector, as well as radical opportunity if we can harness data and information to drive the kind of improvements that we know are possible. That's what the real stakes are for the country, not just in terms of better patient experience, but really national resource allocation, quality of life, and our ability to address so many challenges, both within health and beyond. What's terrific also is that the Healthcare Data Initiative represents one of these ideal partnerships between the public sector and the private sector, where you've got government through an innovative use and release and assemblage and curating of data is able to enable entrepreneurial, innovative activity in the private sector. I think that's the kind of public-private partnership that people talk about, but is all too rare when you see it actually being executed in terms of a major sector like healthcare. It's also something that in this town and even beyond the Beltway, it's nice that all parties can agree upon this. This may be, the Healthcare Data Initiative may be the only thing we see massive agreement on as we go through the rest of this year, but that's exciting, I think, in its own right. So to get the forum started, we're going to have some opening remarks from Bob Kocher and Dick Foster, who are the co-chairs of the HDI Forum 3, the Health Datapalooza Planning Committee. Please welcome Bob Kocher and Dick Foster.
Good job.
Welcome, gentlemen.
Thank you, Matt. Good morning. Thank you very much, Matt, for your great introduction. My name is Dick Foster, and I'm honored to be co-chair with Bob Kocher of this year's Health Datapalooza. So welcome from all of us to all of you. I'm a partner at Lux Capital, so very anxious to be here and meet many of you and talk about your dreams and aspirations for the future.
And good morning. My name is Bob Kocher. I'm a partner at the venture capital firm Venrock and a non-resident senior fellow at the Brookings Institution. We want to thank the Health and Human Services Department, the IOM at Robert Wood Johnson, and the Planning Committee for all of your hard work. This has been months and months of preparation culminating today. It is a thrill to see a large and engaged audience for what's going to be an amazing 2 days. You're about to experience a set of plenary presentations that have been culled from more than 230 applications and honed to be engaging and interesting and show you the breadth of possibility of data and how we're really solving problems today. You're going to engage in a series of breakout discussions where you can dive into the details of topics with a great set of moderators and participants. And even better, you're going to have a chance to have numerous hallway conversations that we hope spark new ideas, new innovations, new partnerships with some companies. We also hope that you tweet about this. Our health data hashtag is health data. And so we want you to talk about this, but we really want you to jump in and enjoy what we think will be the best health data initiative ever.
Thanks, Bob. It's clear that Bob and I are excited about the ability of data to catalyze innovation in healthcare and the formation of new companies and the generation of value and the reduction of cost and the improvement of care of healthcare in the United States. Data has done this in many other cases in the past. We're all aware of what's happened to our weather world, which has all been made available by government data. We want to do the same thing in healthcare. At our first Datapalooza, which was 3 years ago, the goal was to demonstrate that the data that the government held was useful. And out of that exercise came applications and companies like iTriage, Asmopolis, and organizations like Sonoma County, who used this data to convincingly demonstrate that they could provide benefit from the data that was already purchased and present here in Washington. Last year, we attempted to prove that data could generate real value. And out of that exercise came companies like Patients Like Me, Lumeris, and along with the announcement that Walgreens was going to be focused on wellness and patient engagement. And startup health support for entrepreneurs came out of that effort as well, which has been very successful over the past year. This year, we want to go beyond those objectives, and this year we want to reveal how data can really create enduring businesses, and that's why presumably all of you are here, and we would like to help you create enduring businesses that add value to the healthcare system of the United States. After having had the privilege of reviewing all the applications and demo submissions, and there were hundreds of them, requests to make announcements and demand for breakout sessions, I'm pretty convinced that when you see these things today, you'll come away convinced, as Bob and I have, that the health data is in fact creating a vibrant ecosystem which will come to the benefit of the United States. In fact, this ecosystem has grown to the point now where we need 2 days. You were all evidence. We didn't have all of you here last year, and we didn't have 3% of you here two years ago. Next year, we're going to the FedEx Stadium, so if you want your tickets, you ought to sign up before lunch, I'd say. The success of the Health Datapalooza is in large part due to the imagination and leadership of our good friend and evangelist Todd Park, who is truly a national treasure, and you will see him later on this morning. He's now the Chief Technology Officer of the United States. Rumor has it that he will soon be Chief Technology Officer of the world, and I would personally applaud that if that happens. Todd has proved positive that leadership and good ideas can overcome politics and bring people together. Over the next 2 days, we're proud that data is bringing all of us together. Many of us would have no other reason for having met. Hopefully, we'll show that that produces value. So only good things come out of this. And only this initiative could bring together people like Senator Bill Frist, who you'll hear from tomorrow, Atul Gawande, rock star John Bon Jovi, Dr. Harvey Feinberg and Judy Salerno, who guide the Institute of Medicine, John Lumpkin from the Robert Wood Johnson Foundation, and current healthcare system leaders, including Kathleen Sebelius, HHS Secretary, Deputy Secretary Bill Kocher, Deputy Secretary Dr. Scott Gould, and of course, as we said, Todd himself.
So we are fortunate that Matt Miller, the voice from the beginning, will be taking us through today. Tomorrow we have Thomas Gett from Wired Magazine to lead us through the day tomorrow. On behalf of the Planning Committee, I want to thank you for coming, and I wish you a wonderful, exciting, and memorable Health Datapalooza. Thank you.